Navigating a pregnancy brings up a ton of questions, right? And one of the most serious topics out there is high blood pressure. If you're expecting or even planning to be, getting your head around this is absolutely crucial. So today, we're going to break down hypertensive disorders of pregnancy. We'll turn all that complex medical jargon into something clear and easy to understand. So that's the big question, isn't it? What actually happens when these two things collide? Well, it can create a really unique and sometimes pretty dangerous set of conditions that can affect both mom and baby. Okay, let's dive right in and figure out what's really going on here.
So first things first, to really get a handle on this, you got to know the key players. Your medical team uses specific names for these conditions, and knowing what they are is half the battle. Let's meet the three main types.
Okay, it really all boils down to two simple things. When did it start, and what are the symptoms? So if you had high blood pressure before you even got pregnant, that's called chronic hypertension. Simple enough. If brand new high blood pressure shows up after the 20-week mark, but with no other red flags, that's gestational hypertension. But if it shows up after 20 weeks and comes with signs of organ trouble, like protein spilling into the urine, that's pre-eclampsia. And of course, it's not just about which type it is. It's about how high that pressure actually gets. Doctors will classify it as mild, moderate, or severe, and that number is basically the roadmap for how they're going to keep you and your baby safe. All right, let's start with the one that's there from the get-go. Chronic hypertension is pretty much what it sounds like. It's a pre-existing condition that just needs some extra careful management once you're expecting. Now get this, for a whopping 90% of women with chronic hypertension, there's no single clear reason why they have it. It's called essential hypertension. For that other 10%, though, doctors will dig a little deeper to see if there's an underlying cause, which, is most often something related to the kidneys. And this is exactly why that close monitoring is so important. The number one risk here is developing something called superimposed pre-eclampsia, and that happens in about a third of cases. But the other potential risks are just as serious. We're talking placental abruption, heart failure, and even bleeding in the brain. So that brings us to the main event, the condition that really defines this whole topic, pre-eclampsia. This isn't just about high blood pressure. This is a disorder that pops up specifically because of the pregnancy itself, which makes it a whole different ballgame. So here's the official definition. It's way more than just a high number on the blood pressure cuff. The key phrase to remember is multi-system disorder. The high BP is a major symptom, sure. But the real problem is that the condition is starting to mess with other organs, and the kidneys are often one of the first to send up a flare. So how on earth does this even happen? Well, it's a fascinating two-stage process. You can kind of think of it like faulty wiring in a house that leads to a massive power surge. First, early on in the pregnancy, the blood vessels that are supposed to feed the placenta just don't develop right. They don't widen like they should, so the placenta is basically starved for blood. Then, in stage 2, that struggling placenta starts releasing all these nasty substances into the mom's bloodstream, and that causes the power surge of problems everywhere else. And because those substances attack the delicate lining of blood vessels, the damage isn't just in one place. It's body-wide. It makes blood vessels clamp down, which is what jacks up the blood pressure. It damages the tiny filters in the kidneys, causing that protein to leak out. It can even mess with your blood's ability to clot and put a ton of stress on your liver. It really is a full-on multi-system attack. Okay, now this right here is probably the single most important slide for anyone who's expecting. We all hear about those classic symptoms, the bad headache, the blurry vision. But the truth is, most women feel nothing. They feel completely fine or maybe just a little off, like they have the flu. And this is precisely why those routine blood pressure and urine checks at every single prenatal appointment are so critical. They're designed to catch the thing that you can't feel. All right, so what happens if preeclampsia gets worse? Well, that's when we enter the territory of its most severe life-threatening complications. This is what all that monitoring is for. This is what doctors are working so hard to prevent. First up is something called HELLP syndrome. The name itself sounds urgent, right? And it is. It's actually an acronym that spells out exactly what's going wrong inside the body. H is for red blood cells being destroyed. EL is for liver enzymes shooting way up. And LP is for platelet counts plummeting. This is a 5-alarm fire saying the disease has become critically serious. Now, while preeclampsia can be silent, HELLP syndrome often isn't. It usually has some pretty clear warning signs. And the most common one, by a long shot, is what's called epigastric pain. That's a really distinct pain in your upper belly right where your liver is. Nausea and vomiting are also super common. Any of these symptoms are absolute red flags that mean you need medical help immediately. And the other severe complication is eclampsia. This is basically the neurological endgame of the disease. It's when the damage and high pressure finally hit the brain, triggering life-threatening seizures. And preventing this from ever happening is priority number one. So after all that pretty scary information, how is this actually managed? Let's shift gears and talk about the action plan. What doctors actually do to navigate these stormy waters and protect both mom and baby. This right here, this is the fundamental, unshakable truth of managing preeclampsia. The whole problem is caused by the placenta, so the only real cure is delivery. And this creates this incredibly tough balancing act for doctors, weighing the mother's immediate health against the baby's need for more time to grow and develop. Now, a huge part of the plan is controlling that blood pressure while waiting for the right moment to deliver. But, and this is crucial, not all blood pressure meds are safe. Some of the most common ones, like ACE inhibitors and ARBs, are a big no-no because they can cause serious harm to the developing fetus. So instead, doctors turn to a specific list of drugs that have a proven safety record in pregnancy. Labetalol is usually the go-to, the drug of choice, but nifedipine and methyldopa are also used all the time. The goal isn't to get the blood pressure back to perfect, but to keep it out of that severe danger zone. And what about stopping those terrifying seizures we talked about? Well, the hero drug here is magnesium sulfate. It's given through an IV in severe cases to protect the brain, and it is incredibly effective at both preventing eclampsia from happening and treating it if it does. So, to wrap up the whole strategy, it really comes down to surveillance. It's all about constant, careful monitoring of mom and baby, using the right medications to control the blood pressure, and then making a really strategic, well-timed decision on the absolute safest moment for delivery. And that leaves us with one final big picture thought. For decades, the only real answer we've had is to end the pregnancy. But as we get better at understanding that very first stage, that faulty wiring in the placenta, the real question for the future is this. Can we ever find a way to treat the root cause? Can we fix the wiring instead of just managing the power surge? Now that would be the breakthrough we're all waiting for.